So, what are the various disorders of speech and what are the statistics?
Luckily, many children go through these phases, but there are very unfortunate children who don't go through these phases. They are known as delayed speech and language development. Some problems are genetic, some problems are environmental. For example, if a child has got a severe or a profound hearing loss, the child will not be able to hear the sound and will not be able to produce the speech. That is one of the common consideration where the children, in the former days, they used to be called as deaf and dumb, but the word dumb is being removed because every child can be trained to speak. So we here mention specifically not even of deafness, but of hearing impairment. So this is one of the condition that happens. The second condition common is cleft lip and palate, because there will be hole in the lips and hole in the palate where the child is not able to bring out the proper voice and the proper articulation. The third important condition is the child is got subnormal intelligence, because due to some of the chromosomal effect like Down syndrome and other things, where the retardation of the brain performance takes place. We don't call it retardation, but the performance of the brain is a little bit slower, and thereby they develop the speech and language delays. Then we have what is known as cerebral palsy, a neurological condition where there is a neurological deficiency in the muscles, and this affects the articulatory muscles of the speech and the breathing patterns, and there are a whole series of patients with this disorder. Then we have got what is known as congenital neurological disorders that are very much prevalent, and of late there is a new condition, not new condition, it's an old condition, but it has become epidemic in proportion, called autism. So autism has become a very rapid condition. At least one baby in 300 in India has got autistic features basically. There are several stages of autism which are high functional, mid functional and low functional. If you take the statistics of 300 live births, one child is affected with autism. You can imagine the number of patients that are there in India as well as in other parts of the country. Those children who have got high functional autism, they don't have much problem, but those children who are not on the high functional or in the lower functional category of autism, they are truly affected by this condition.